Welcome to Strike Stroke. My name is Dr. Mekdes. Today we will talk about hemorrhagic stroke. So we can break down hemorrhagic stroke into two categories. One, intraparenchymal hemorrhage, and two, subarachnoid hemorrhage. In this episode, we will talk about intraparenchymal hemorrhage. So intraparenchymal hemorrhage means bleeding into the brain parenchyma or brain tissue. So there are many causes of intraparenchymal hemorrhage. The most common cause is hypertension. Other causes include head trauma, bleeding disorder, use of blood thinners, bleeding into an area that just suffered an ischemic stroke, vascular malformation such as atriovenous malformation, inflammatory infection conditions, brain tumors that are prone to bleeding such as melanoma, renal cell carcinoma, thyroid cancer, lung cancer, also amyloid angiopathy, cocaine, methamphetamine use. But the most common cause of intraparenchymal hemorrhage is hypertension. So hypertensive bleed or hemorrhagic stroke due to poorly controlled hypertension affects the same areas that are prone to having lacunar strokes. These areas are in deep part of the brain. They include the basal ganglia, thalamus, internal capsule, anterior pons. This is an exception to the cerebellum. The cerebellum is prone to having hypertensive bleed, but we don't see lacunar stroke in this area. These areas, such as the basal ganglia, thalamus, internal capsule, anterior pons, are supplied by small arteries called perforators. These arteries come off of large arteries to supply these areas. They're very susceptible to damage due to chronic hypertension. So since hypertension is the most common cause of intraparenchymal hemorrhage, let's talk about how this happens. So if we were to take the lenticulostriate arteries, for example, these arteries branch off of the middle cerebral artery on both sides to supply the deep part of the brain, as we talked about, such as the basal ganglia, the internal capsule. So with chronic hypertension, these arteries develop tiny aneurysm called Charcot-Bouchard aneurysm. And with ongoing uncontrolled chronic blood pressure, these aneurysms one day could rupture, leading to intraparenchymal hemorrhage. Hypertension is a silent disease. It is very critical that we prevent from developing elevated blood pressure if we can help it. But if we were to develop high blood pressure, it is very important to combine lifestyle modification and taking blood pressure medication to keep our blood pressure close to normal range, which is less than 120 over 80 if we can help it. Blood pressure management is different for everybody depending on their other disease process. But for the most part, having close to normal blood pressure should prevent you from having complications such as hemorrhagic stroke that we just talked about, along with other issues such as kidney failure. In conclusion, today we talked about hemorrhagic stroke. We said that there are two types of hemorrhagic stroke. One is intraparenchymal hemorrhage, which means bleeding within the brain tissue itself, and two, subarachnoid hemorrhage. In this episode, we talked about intraparenchymal hemorrhage, and we said that the most common cause of intraparenchymal hemorrhage is high blood pressure or untreated high blood pressure. And we talked about the mechanism of how high blood pressure causes intraparenchymal hemorrhage by causing small aneurysms in the lenticular striate, for example, called Charcot-Bouchard aneurysm, which could rupture one day, leading to intraparenchymal hemorrhage with the deep part of the brain. In the next episode, we will talk about subarachnoid hemorrhage. Thank you for watching. I hope you found this information useful. Always remember to dial 911 if you or someone near you suddenly can't see, can't speak, can't walk, or can't feel. Let the operator know that you or someone near you might be having a stroke so that you or the individual near you can be transported to the nearby comprehensive or primary stroke center for rapid stroke analysis and tailored treatment.